In this video, we're going to be looking at the anterolateral and abdominal wall section of the course pack. This resource is brought to you by the Scrubs team, which is the Student Collaborative Resources for Understanding and Brody Success. My name is Bryce Pugh, and I'm in the class of 2027. So we'll start with our mission statement. Scrubs is a student-driven initiative that aims to develop supplemental resources for current and future cohorts that will pass through Brody. Members of Scrubs participate in a variety of subcommittees working to create resources for students by students. These resources aim to offer unique perspectives from students that have walked in the same shoes as you, developing resources that we wish we had been exposed to during our time in the course. The hope is that this organization will become a staple of the Brody student body, exemplifying the unique collaborative community that Brody offers. If this is a mission that aligns with your goals and you have the desire to help those that will come behind you, as well as the goal to leave your mark on Brody as a whole, we invite you to join the team. Also, a quick disclaimer, the resources that are used in this document are made by the students and not the faculty. As such, there's a possibility for error in our development, although this is mitigated via team approach to development with multiple stages of vetting. If there's a contradiction within the coursework presented from the course to this document, please go by the course documents. Additionally, Scrubs aims to supply supplemental resources. However, these are in no way a replacement to the instruction of the Brody faculty. Use these resources as a supplement, but not as your primary resource for the course material. So to start this off, we'll look at some osteology, a little bit of review, and a little bit of new stuff. So we want to be familiar with the xiphoid process, which is going to be right here. Remember, that's the most inferior portion of the sternum. We have our pubic symphysis, and so looking down here, kind of at the pelvic region, we have a lot of bony stuff that we want to look at. And so first is going to be our pubic symphysis, which is highlighted here. And that's going to be this piece connecting the two plates of the pelvis. Next, we have our pubic tubercle, which is going to be the tubercle. We should recognize that term from looking at some of the long bones in the arms and stuff, but that's going to be this protrusion of the bone here. We also have our anterior superior iliac spine, or ASIS. That's going to be up here, and that's looking at this part right here. It's going to be right there. And then we have our pectineal line, which is going to be down at this portion. And so we're going to have different muscles and stuff that are going to attach at these different regions, so it's just good to have an idea of what we're actually talking about. And so what a really big focus of this section is going to be is the abdominal wall layers. And so when we're talking about it, we're going to be looking a lot at this region of the body, and so we're going to be looking in from a lateral view. And so a brief overview before we look at each of the sections, from out to in, superficial to deep. We're going to have skin, or a dermis, camber fascia, which is also a superficial fatty layer, scarpa fascia, which is a membranous layer, our external oblique muscle, internal oblique muscle, transversus abdominis muscle, transversalis fascia, extraperitoneal fat, and then the peritoneum. And so these layers are going to be really, really important that you know these through and through. Inside to out, outside to in, at different regions as well, and we're going to look at all of it in more depth, but be sure that you can recognize all of this stuff. And so looking at our abdominal wall layers, first we'll start with the skin, and the main thing that we're really going to see here is going to be our umbilicus. This is also known as our belly button, so that's going to be right here, and this is found midway between our xiphoid process, which will be up here, and the pubic symphysis, which is going to be down here. And so you can see that here. And then a lot of what we're going to look at is kind of in this region here. And we also want to note that the umbilicus is a good superficial landmark for the intervertebral disc between L3 and L4. So that's about the level that we're looking at here. Moving a little deeper, we're going to find the superficial fascia layers. And that's going to be our Camper's fascia, which is the superficial fatty layer. And that can be seen in yellow here. So it's going to be this really fatty looking superficial layer. That's also yellow here. And then a little deeper to that, we're going to have the Scarpa's fascia, which is our membranous layer, and that's in green here and blue down here. And so you can see the regions it covers and kind of the comparison between the two. The membranous layer, or Scarpa's fascia, is going to connect to superficial perineal fascia of the perineum and fascia lata of the thigh. And we'll look at those when we move forward into the course pack, but just know that it connects to some other fascia layers throughout the body, up here and down here. We also want to note the fundiform ligament of the penis. And this is going to be thickened in males at the midline. So looking at our Scarpa's fascia, at the midline, it's going to thicken and it's going to pass inferiorly on each side of the penis. And now we're going to come to our abdominal wall muscles. And so we're going to have 4 muscles that we want to look at here. And these are listed from superficial to deep. So our first one is going to be the external oblique muscle. And this is going to be a flat muscle. And so you'll see this trend. We're going to have 3 flat muscles and then 1 strap-like muscle. So our first flat muscle is our external oblique. And they're also listed kind of left to right here. So that's going to be here. It's going to originate from our lower 8 ribs. You can see that along this line. And it's going to insert on the iliac crest, the pubic tubercle, and the linea alba. And the linea alba we'll look at more later too, but that's going to be kind of this white bundle of fascia that runs up and down the midline here. Innervation, we're going to look specifically at innervation of everything later on, but all of these are going to get innervation from a few different things. It's going to be our lower intercostals that are running between the costals, specifically T7 through T11, our subcostal, which remember is T12, and the iliohypogastric and ilioinguinal nerves, and those are both from L1. And so that's going to be the same thing for all of these. Our action is going to be the same for the flat muscles are going to be the same, and then the strap-like one will have a different one. So all of the flat muscles are going to work on lateral flexion and rotation of our trunk. That's the main function, but what they're also going to do is increase intra-abdominal pressure, and that's going to be really important for defecation and urination and things like that. So that's our external oblique. We move a little deeper to that, so you can see that's retracted here or cut out, and we're going to see our internal oblique. So external, more superficial than internal. And this is going to originate on the iliac crest here and the inguinal ligament. It's going to insert on the superior fibers, the superior fibers are going to insert on the lower 2 ribs up here, and the middle fibers down here are going to insert on the linea alba. Same nerve innervation and same action. Our transversus abdominis is the deepest flat muscle, and it can be seen up here. It's running a little more transversely, as given by the name or as hinted to by the name, but it's going to originate from our lower 6 costal cartilages and the iliac crest, the thoracolumbar fascia, and the inguinal ligament. And so that's a lot of things, but you can kind of get an idea for where it's inserting and originating based on this picture. So it's going to insert on this side at the linea alba and conjoint tendon, which is down here. So it's going to essentially just insert over here at the midline and originate a little more posteriorly, as well as some other spots. Finally, that's our 3 flat muscles. We're going to have a strap-like muscle called the rectus abdominis, which is pictured here, and this is going to make up your abs. So when you see someone has a 6-pack or something like that, that's going to be the rectus abdominis that you're seeing. It's going to originate from the superior ramus of the pubis, and so you can see that here down on this bone where it's originating. It's going to insert on the xiphoid process and costal cartilages 5 through 7. So originate down here, insert up here. And based on its positioning, you can imagine if this flexes and contracts, it's going to flex our trunk. And so that's, if you're doing sit-ups or something, it's really going to use that. And it's a really powerful flexor of the trunk too. And a special thing worth noting is that the internal oblique fibers run perpendicularly to the external oblique. So you can see that pictured here. Our external obliques are running in this position where if you were to put your hands in your pockets, kind of along with that, if we go deep to that, our internal oblique is going to run perpendicular, and so that's going to be running the opposite direction. And so still looking at our abdominal wall muscles, there's a few things that we want to note here. First is our inguinal ligament, and this is really, really important. This is going to be the inferior thickened border of the external oblique muscle. So we can see our external oblique over here. The inferior border is going to have this aponeurosis, and it's going to have this really thickened border right here that you can see is tagged as the inguinal ligament. And this is going to be really important moving forward. So keep in mind that this is the inferior thickened portion of that muscle. Next, we're also going to have our conjoint tendon. And what this is, the aponeurotic fibers of the internal oblique and transversus abdominis, so our middle and deep layers of the flat muscles, so these 2 here, they're going to combine at their aponeuroses and insert down on the pubis. And then finally we have our linea alba, which we briefly mentioned. It's going to run up here, from bottom to top, and it's going to intertwine. It's an intertwining of the aponeurotic fibers of all three flat muscles. So all three of these are going to combine and run up and down here in the midline. And now continuing with our abdominal wall layers, deep to the muscles, so we've gone through to this point. Once we get deep to the muscles, we're going to hit our transversalis fascia, and this is going to be important clinically for a certain region that we'll talk about later. It's also known as our endo-abdominal fascia. Deep to that, we're going to have extra peritoneal fat before our peritoneum. So extra outside of our peritoneum, we have extra peritoneal fat. Finally, we get to our peritoneum, which again, we're going to look at more in the future, but it's this serous membrane lining of the abdomen. And we're going to have a parietal and visceral layers. And we should be starting to get pretty familiar with these terms just by looking at things like the lungs, where we see this kind of structure forming where we're going to push into it. And the part that pushes in is going to be wrapped closely by the visceral layer. And then our parietal layer is going to line the cavity walls. So now let's look at our rectus sheath. And this is going to be really, really important. Again, more stuff to know, layers and stuff like that. But when we look at our rectus muscle, we're going to have a rectus sheath that's going to wrap around it. And that's going to be formed by a lot of these layers. And so the aponeuroses of all of the flat muscles are going to form the rectus sheath that's going to wrap around like this. And so the layers are actually going to vary at different distinct levels. So if you take this cross section right here, it's going to look a good bit different than if you take a cross section right here. And so we're going to look at, this is just a simplified drawing that looks at it in three different regions. So we're going to have sort of a superior look, which will be higher up, a middle look, which will be around here, and a more inferior look down here. And so you can see this point here is our umbilicus. So that's going to be right here. And then we're split right there. So our superior region, which is going to be up here and demonstrated by up here, is going to be at the xiphoid process, and we're only going to find the external oblique. And that's going to run superficial to the rectus abdominis. And so this diagram is split by, if this line represents the linea alba, we have muscles that are superficial to our rectus abdominis and muscles that are deep. So superiorly, we're only going to see external oblique. We move down in the middle region, so right here, this is going to start to form just above the umbilicus, and it's going to go to midway between the umbilicus and the pubic symphysis down here. So halfway between is going to be right here. In this region, we're going to see the internal oblique is going to split. And so we'll have an anterior internal oblique and a posterior internal oblique. And you can see that right here in this orange section. So it's going to come, split, the posterior is going to run behind it, the anterior is going to run in front of it. And so superficial in front of it, we're going to have our internal oblique as well as the external oblique. So that's continuing from up here. Deep to it, we're going to have the posterior portion of our internal oblique as well as our transversus abdominis muscle. So our internal oblique, the middle one, is going to be split. Our deep one is going to run behind it, deep to it. And then our most superficial flat muscle is going to run in front of it. Continuing down, we're going to see this really important structure, which is the arcuate line. And we can see that's a little represented right here. And we'll look at that in the future a little more. But the arcuate line is going to be this point where all three of our flat muscles, the aponeurotic layers, are going to pass anteriorly to the rectus muscle. And so we can see in the diagram down here, anteriorly, we're going to have all of them passing in front. And you can see that here, that they're all kind of running in front of it. Deep to that, however, we're still going to have transversalis fascia, and we'll look at the clinical importance of that in a little bit, and our peritoneum. But all of the muscle, aponeurotic fibers, stuff like that is going to run anterior to it. And this is located midway between the umbilicus and pubic symphysis, which we already defined as that border, and just run inferior to that. Another thing that we want to note here is that the rectus sheath, or the rectus abdominis muscle, is going to be split into 3 or 4 pieces by 3 or 4 tendinous intersections, and that's going to form our abs that we talked about. There is a smaller, more insignificant muscle that not everyone has, but it's called the pyramidalis, which is a small triangular muscle on the anterior surface of the inferior rectus muscle. So it's not pictured in this, but it's just this little triangle muscle that's going to come up right here. And so it doesn't play a huge role that we need to know, but just keep in mind that it's there. And so now let's look at innervation. So we already talked a little bit about muscles, but our skin and muscles are going to be supplied almost entirely by our lower intercostals, T7 through 11, and our subcostal, so essentially T7 through T12. So they're going to do pretty much everything here, but we do have a little bit of other stuff going on. So these two are going to run between our internal oblique and our transversus abdominis muscle for the most part. And so that's going to be our middle and our deep layer. And that makes sense because when we were looking up here around the thorax, they also ran between the middle and deep layer. So that's going to kind of continue down through here. Other nerves worth noticing are going to be branches of the lumbar plexus, and they're going to supply the inferior abdominal wall down here. And so the two big ones that we want to note are the iliohypogastric and the ilioinguinal, and those are both going to be coming from L1. And so now let's look at dermatomes. So this is going to be cutaneous innervation, and this is a really, really important concept to get down. So we've already talked about what dermatomes are previously, but there's a few landmarks that you really want to know, and that's going to be the xiphoid process being at T6, even though it's kind of pictured funnily here. We want to know that the xiphoid process is at T6, and that's our red star. Our umbilicus, our belly button, that's T10. And then our pubic symphysis is at L1, and so that's the green star down here. And that's going to be kind of like an underwear-shaped superior medial thigh region. And that's going to be important for a certain reflex that we'll look at later. But xiphoid process T6, umbilicus T10, pubic symphysis L1. Make sure you know this. Now let's look at vasculature of this region a little bit. And so we have a few different branches and vessels that we really want to know. So our first one obviously is going to be our intercostals. So we talked about how the intercostal nerves are going to play a big part. Our intercostal arteries are also going to play a big part. And so we can see those running along here. We also want to look at a particular branch of our internal thoracic artery. So we know our internal thoracic is running down the thorax. It's going to give off one of its branches, which will be the superior epigastric. And that's pictured here. So our superior epigastric is going to come down and anastomose with the inferior epigastric, which is a branch of the external iliac. So that's going to be deep to our rectus abdominis. We're going to have our superior epigastric and our inferior epigastric that are going to come together and meet. Our inferior epigastric is going to enter the rectus sheath at the arcuate line. So we mentioned what the arcuate line was. It's going to enter there, branch, and then anastomose with the superior epigastric, as well as some of the intercostal arteries. Another branch of our external iliac artery is going to be the deep circumflex iliac, and that's pictured here. So it's going to run up here. And again, don't try too hard to associate specific muscles or exact regions with these vasculature, because blood almost always is just going to supply more regional rather than specific muscles. Continuing, we're going to have our lumbar artery, which is going to be coming right here. And then we're going to have superficial branches of our femoral artery, which are all of these here. And that's going to be our superficial epigastric, our superficial circumflex iliac, and our superficial external pudendal. And so those are highlighted, just kind of further supplying this region down here. So now we want to move on to the inguinal region. The inguinal ligament is going to be this down here that we talked about. It's the inferior portion of the muscle, and it's going to come from the anterior superior iliac spine. So remember, that was the ASIS that we looked at the beginning, which was back here, and it's going to extend to the pubic tubercle. We're also going to have our lacunar ligament, which is going to be this medial flattening of it that's going to attach at the pectineal line. So we have our inguinal ligament, and kind of down here medially, it's going to flatten and attach to the pectineal line as the lacunar ligament. And so let's look at the inguinal canal, which is going to be this canal running through this inguinal region. And it's really, really important. There's a lot of stuff going on here. And so don't get overwhelmed. We'll walk through this. This is just a quick sketch that I drew. You can find some other drawings in other places. But our inguinal canal is going to be this pathway that runs through this region. And we'll go back to look. So we're looking at this region here. It's going to be this canal that runs through there. And we're going to define it all with boundaries, just like we do with everything. So we're going to have a roof, an anterior wall, a posterior wall, and our floor. And then it's kind of forming like this tube. And so we're going to have an entrance and an exit. And so our roof is going to be the internal oblique and transversus abdominis muscles. And so you'll see this mnemonic MALT or some other stuff. So from roof, anterior, floor, posterior, so moving in a circle, we're going to have muscles, aponeurosis, ligaments, tendon, for the most part. And so our roof is going to be these two muscles. Our anterior wall, in gray, is going to be formed by the aponeurosis of the external oblique muscle. The external oblique muscle. Our floor is going to be formed by the inguinal and lacunar ligaments. So our inguinal ligament running down here in light gray, and the lacunar ligament right there. And then our posterior wall is for the most part going to be formed by transversalis fascia, and that's going to be this light pink here, which will be clinically important in a second. But it's not as defined as this in a real cadaver, where it's just this nice canal, and these all kind of approach at different ways, but this is generally a good idea of how things are going to run. And so the entrance to our canal is going to be up here, and it's going to be our deep inguinal ring. And you could pass through the canal, and you could exit down here more medially at the superficial inguinal ring. The contents of it, so what's actually running through the canal, the main thing we want to look at is the spermatic cord, and that's this dark blue tube here. So our spermatic cord is going to run through here in the male, and then in our female, the main thing we want to look at is our round ligament of the uterus, and so that's going to run there. We also have a little bit more going through here, so we have two important nerves, and the main one that you want to look for in the lab, at least, is going to be our ilioinguinal nerve, which is from L1, remember? And so that's also going to pass through here. We also have our iliohypogastric nerve that you'll see in lab that does not run through the canal. So the iliohypogastric does not run through the canal. It runs external to it up here. But also running through the canal is our genitofemoral nerve, and we'll talk a little more about those in a second. Here's another picture, just kind of helping reinforce this idea that we have this roof of these muscles in green. We're going to have our anterior wall, that's the aponeurosis. We're going to have our floor, which is the inguinal ligament. And then posteriorly, our posterior wall is going to be this transversalis fascia. And so we looked at the inguinal canal right here. Next to it, we're going to have this structure that's going to be the inguinal triangle. And it's more just like a region that's clinically significant. And so our inguinal triangle, also known as Hesselbach's triangle, is going to be right here. And it's this weak spot in the abdominal wall because the posterior wall is, for the most part, only transversalis fascia. And so in some other regions, we have a few more layers that are thick. We pretty much just have this fascia right here. And so that can lead to things like hernias that we'll look at the end of the video. But that's what this is. And so the borders are going to be formed by our inguinal ligament, which are coming down. We're going to have the rectus abdominis running up and down the body, kind of around the midline. And so that forms that. And then our inferior epigastric vessels, the artery and vein, they're going to form the triangle here. And so between that will be our inguinal triangle. And so now let's look at the coverings of the spermatic cord. So we looked at the spermatic cord right here, this blue structure right here. And this is really important for development, is the testes will pass down through here and come down into the scrotum. And we'll talk about that. So the spermatic cord is going to be running through here. And so one thing we want to note is the gubernaculum, which is this ligament that's going to indicate the site of the future inguinal canal. So we're looking at kind of embryologic development right now. That's going to be this blue structure here, is this ligament. And it's going to connect to and guide the testes through the inguinal canal and down into the scrotum. We also want to look at our processus vaginalis, which is right here, not completely inside this box, but that's highlighted here in yellow. And so you can see 3 different stages as the testes are kind of moving down into the scrotum, and the green is going to be the spermatic cord. You can see that's going to follow it. But this processus vaginalis is going to be this peritoneal evagination that's going to come down more and more and more into here. And you can see at this point it'll be the tunica vaginalis in the future. But it's gonna form the deep inguinal ring as it's doing this. And so one really important thing is we're kind of forming the scrotum. We're gonna be pushing all of this stuff down here. The testes are gonna move down into here, and with that, they're gonna bring a lot of the abdominal wall layers into them. And so we're gonna look at those. So I know this is colors all over the place, crazy confusing, but this is really, really important. You want to know this slide really well. You want to know all of the layers and everything as well as you can. And so we look at the testes coming here. They're going to come down through here and push down the abdominal wall layers that are right here and extend them into the scrotum. Once they're in the scrotum, we're going to give them different names. And so we're going to look at the layers of the abdominal wall and the corresponding layer of the scrotum. So you can see the abdominal wall up here, you see the scrotum down here, and so we can see they're completely continuous for the most part. And so to quickly run through these, but you'll definitely want to spend time learning this, we're going to have the skin just become skin, our superficial fascia, and these are color coordinated too. Our superficial fascia is going to become the perineal fascia and dartos muscle. Our external oblique is going to become the external spermatic fascia. Our internal oblique, in orange, is going to become the cremaster muscle and fascia. Our transversus abdominis, you can see, actually just stops right here. It's not going to continue down. And then our transversalis fascia is going to become the internal spermatic fascia. Our extraperitoneal fat up here is going to continue down as the areolar tissue in the cord. And then finally, our peritoneum, purple, is going to have this tiny little continuation down that's the tunica vaginalis. And so you could probably find a ton of different mnemonics for this online. Find one that works for you. I made one up right here just to give you something to start with if you like it. I didn't include skin just because you should be able to remember that skin goes to skin. That one's easy. So if we simplify by taking that out, we're going to have, just by the first letter, an acronym. Some people enjoy eating ice cream today, period, because there's no one that goes with that. Try instead eating a pickle tomorrow. Something like that. There's other ones, but whatever helps you, make sure you know this slide really well. And so let's look a little more at the testes, because the anatomy is going to be really important, especially for lab, knowing the different parts of this. And so once you have the testes dissected in lab, you'll kind of have something that looks a little bit like this, maybe a little more dissected along here, but we can kind of see the layers as we go through. So up here we have our cremaster muscle and fascia that are going to continue down. We spread that open, retract it. Covering that, we're going to have our external spermatic fascia, but covering that, or outside of that, we're going to have the muscle and fascia of the cremaster right here. Deep to that, we're going to have our internal spermatic fascia. We retract that. We're going to have our tunica vaginalis, which is we'll see our parietal layer first, because parietal is going to be the wall, the outside. And then inside, we're going to have our tunica vaginalis, or the visceral layer, which is covering the testes. And so we can also see the epididymis right here, which is more highlighted right here. And so we'll look at the contents that lead down to this in the next slide, but what we really want to get here is that we have the testes right here, and the epididymis is going to kind of wrap around it, and it's going to be the continuation of this structure called the vas deferens. So the vas deferens is going to come down here and form this structure right here. And so the fat part at the top is the head of the epididymis. We move down, we have our body, and then just at the bottom we're going to have the tail, and then we become the vas deferens going up. And so we can also see here our visceral layer of the tunica vaginalis wrapping around this, and then our parietal layer of the tunica vaginalis. And so looking at these contents right here that are going to lead to it, or these contents here that are actually in the spermatic cord, here's a simplified drawing I've given. So this is our spermatic cord. Let's open that up, and this is kind of what your dissection will look like in lab. So we're going to have three main things with a couple other little structures we need to know. And so first, perhaps the main one is going to be the vas deferens or the ductus deferens, which are the same thing. It's going to run down here, and like we said, it's going to become the epididymis. And so on that, there will be a really tiny artery that's called the artery to the vas deferens, or the deferential artery. And so those should be attached and running together for the most part. Also, we're going to have running, most likely separately, is going to be the testicular artery, which is going to go to the testicle. And then the third main thing we're going to have is our pampiniform plexus of veins, which is going to be this big plexiform of veins. And sometimes these will get all intertwined, like these can wrap around the testicular artery, and it'll just depend on how you dissect it. But we're going to have veins, artery, and our vas deferens. We also are going to have some other stuff. These are going to be the main things you want to look at in lab, but we do have other stuff running through here. We're going to have lymphatics, we're going to have autonomic nerves, and we're going to have the genital branch of the genitofemoral nerve. And so further looking at the spermatic cord components, we're going to say our genitofemoral nerve and our ilioinguinal nerve. So those can be seen really tiny right here. We have our genital branch, or our genitofemoral right there, and we have our ilioinguinal right here. And so these are going to emerge through the superficial ring. So we saw that those run through the inguinal canal. They're going to emerge through the superficial ring, and they're going to give anterior scrotal or labial cutaneous innervation, and that's going to be in the male or female. In females, the ovaries are going to remain in the pelvis. And so we talked a lot about kind of the testes and the process in males, but in females, the ovaries are going to remain in the pelvis. The gubernaculum is going to persist as the round ligament of the uterus. And through the inguinal canal, this round ligament is going to run through the inguinal canal and terminate in the labia majora, which is homologous to the scrotum of the male. And to end this video, let's look at some clinical anatomy. So a few quick ones, and then we'll have a really big one on the next slide. But you can get rupture of the male urethra, which can lead to urine accumulation between the abdominal wall layers. We can also test the cremaster reflex, which is for the most part going to be present in young males specifically, and it kind of diminishes with age, but it's going to test the integrity of the genitofemoral and ilioinguinal nerves. And this is because they both share the same L1 dermatome that we looked at, the one that looks like underwear that you're wearing. And so what you do is you stroke the skin of the superior medial thigh in that dermatome region, and that'll kind of cause the cremaster muscle to pull the ipsilateral testicle, so the same-sided testicle, up toward the inguinal canal. Next, we can have hydrocele, which you can see down here. This is going to be fluid accumulation in the tunica vaginalis, or a patent processus vaginalis. And so we can see here, this is our normal one. You can see our tunica vaginalis right here where the laser is pointing. Hydrocele is going to be where we have all this fluid filling up right here. With varicocele, which is going to be over here, this is going to affect the pampiniform plexus, and it's going to cause it to become dilated and tortuous. So you can see this is a normal one on this side. This is one with varicocele. And then finally on this slide, we have vasectomies. And so vasectomies are bilateral, so both sides, ligation of the ductus deferens or vas deferens. And this is going to be, you can go in here and you can see they'll like snip it or clamp it or do something to prevent continuation of this. And so when performing this procedure, the surgeon or whoever's doing it is going to locate this region, the vas deferens, by incision in the superior wall of the scrotum. And then finally, one of the more important clinical correlations of this unit is going to be inguinal hernias, because they're really, really common. And so an inguinal hernia is going to be a protrusion of the abdominal viscera through the inguinal ring. And so we're going to have two kinds. We're going to have a direct kind, which is up here, and an indirect kind, which is down here. And so I got our previous drawing and I kind of just overlaid what the process is going to look like. So a direct inguinal hernia is going to come back to where we talked about the posterior wall only being formed by transversalis fascia. And so since it's only formed by transversalis fascia, it's really thin and it's pretty prone to hernias that kind of bust through. And so a direct one is going to go directly through the abdominal wall in this inguinal triangle, which is medial to the inferior epigastric, because we saw that that's the lateral border here. And it's going to pass through the superficial ring of the inguinal canal only. So it doesn't go through the deep ring. It's going to enter kind of from the side and pass through the superficial ring only. And this is most common in adult males. We can also have an indirect inguinal hernia, which is going to pass through the deep and superficial rings. And so it's going to pass all the way through the inguinal canal. And you can see that here in this big purple structure. And so this is going to travel lateral to our inferior epigastric vessels. So you can see that here. And this is often due to a patent processus vaginalis. And so this is going to be most common in young males because it's going to be more of a developmental thing in a lot of the cases. So this will direct, most common in adults, indirect in young males. And the reason that these are mostly in males, they're actually pretty rare in females. So the inguinal region in females is going to be much firmer due to fewer and smaller structures passing through the abdominal wall. And so that's why it's going to mostly happen in males.